It wasn't until the late 19th, early 20th century that public health reformers and public health lawyers began to see a common thread in their work, a shared understanding of the causes of disease and the ambitious sweeping action that would be required in order to protect the public's health. Let's now turn to what we call the most important case in public health law, certainly a foundational case, and it comes from the early 20th century, Jacobson v. Massachusetts. Jacobson was a landmark Supreme Court case on the constitutionality of mandatory public health control measures. In 1902, there was a smallpox outbreak in Cambridge, Massachusetts. The defendant, Reverend Henning Jacobson, refused to be vaccinated as the law required at that time. He was fined $5, which would be roughly about $130 today, and he refused to pay it. And he challenged the constitutionality of the law in court. This case made it all the way up to the Supreme Court, where the Supreme Court affirmed the state's use of police powers to require mandatory vaccinations for smallpox. And the judges in that case, or the justices in that case, noted that there are manifold restraints to which every person is necessarily subject for the common good. Now, this case is over 100 years old, but it is still very important to public health practice today. It represented the beginning of an application of modern constitutional analysis to disease control law and to public health actions. And there were at least 4 key holdings that are important today. The first is the use of police power for public health concerns. It affirmed the state's ability to use police powers for public health. It also affirmed the ability for states to delegate certain authorities to health agencies or lower-level government subdivisions. It also provided support for actions that may limit individual liberty for well-established public health interventions. And it also provided constitutional support for a spectrum of contemporary public health laws that both Matthew and Dr. DeSalvo will expand on in just a few moments. So this has held true ever since. This table lists 4 of the 10 great public health achievements of the 20th century, originally described by CDC in the Morbidity and Mortality Weekly Report in 1999. As you can see here, none of these would have been possible without law and legal tools. So what does this mean for you? To apply law and policy to your important work in public health, it's really important that you understand the constitutional framework for public health practice in this country. The U.S. Constitution distributes power between the federal, state, and local government. We call this federalism. And it also provides a framework for the balancing of public health and individual interests. The federal government's powers come from Article 1, Section 8 of the U.S. Constitution. There's a set of enumerated powers for the federal government, and they include things like the power to tax and spend, the authority to regulate interstate commerce. But in the realm of public health, those are really limited authorities. What you'll notice is that while we have the authority on the federal level to quarantine at state lines and along our borders, the majority of core public health activities lie in the hands of the states. This power is known as the police power, and it's expressed in the 10th Amendment to the Constitution, which grants all powers that are not explicitly given to the federal government to the states. This concept of police powers is particularly important for our work in public health. It's important to note that courts generally allow state and local governments to exercise their police power as long as the action is reasonable and is for the purpose of promoting the general health and well-being of the community. And states can delegate this power or share it with their local governments. So some states give local governments extensive police powers. For example, Florida and Illinois, and California, as you see on the slide here. And others greatly limit the ability of local governments to exercise their police powers. Arkansas and Nebraska are examples of states that limit local police power. This excerpt is from the California State Constitution, which, as you can see, gives their local governments broad police powers. So what about Native American tribes? Well, tribes have a special status with their own set of powers and their ability to govern themselves to a significant extent. We call this tribal sovereignty. On tribal lands, which is known as Indian country, tribes have the power to do what's necessary to control their internal affairs and preserve their self-government, including the ability to create their own laws and health regulations that protect the health, safety, and welfare of tribal communities.
CDC Director, Dr. Thomas Frieden. Law is one of the many important tools we can use to protect the public's health and safety. Law touches every aspect of our day-to-day lives, from the seat belt you used on your way to work, to the clean air you breathe, to the water you use to make your food. Laws are in place to protect your health and safety when suggestions or education aren't enough. Some of the great public health success stories of history, childhood immunization, safer workplaces, clean water, wouldn't have been possible without changes in laws and policies. In fact, federal, state, tribal, local, and territorial jurisdictions routinely use law to make individuals' default decisions healthier and to protect us from threats that we can't individually control. Law and public health are inextricably linked because law is a key function to leverage better, faster, and longer-lasting public health outcomes. Legal interventions aren't usually our first choice, but they can be very powerful, especially in combination with more traditional public health action. Because of our mission to protect our nation by rapidly and effectively responding to health threats, CDC has a unique perspective on public health law. We use it to research new approaches and inform public health practice around the country and the world. CDC's Public Health Law Program, in partnership with other parts of CDC and organizations from many different sectors, studies the relationship between law and health and promotes best practices in the application of law and policies.